So, good morning, everyone. Dr. Shaima here. We have a small topic to be done here, which is an artificial respiration. The definition of artificial respiration, the different indications when artificial respiration is given, the different methods and techniques used. I'll be also, doing CPR or cardiopulmonary resuscitation. So, this question uh, is an often asked university question. So, first, let's see what artificial respiration is. How would you define it? Whenever there is a respiratory deficiency or an arrest of respiration, artificial respiration is normally given to the subject till the normal rhythmic respiration is restored. Because the basic reason is the brain cannot survive, for very long in the absence of oxygen supply. So, hence the need of, giving artificial respiration is immediately done. Artificial respiration is indicated in a subject with respiratory deficiency but with a functional heart. So, just look at the slide how the definition is given. It's basically the first aid life-saving procedure performed. It can be either mechanically or manually to restore or maintain respiration by forcing air into the lungs in a rhythmic manner in a person who has stopped breathing. And it's always accompanied, or most of the time accompanied, with CPR or cardiopulmonary resuscitation when the heart stops its pumping activity. So that's basically what the definition of artificial respiration is, and how an artificial respiration done either mechanically or manually most of the time is accompanied by CPR, where when the heart has stopped its pumping activity. Now let's see what the indications are. Indications, basically what I mean is, when do we think of giving artificial respiration or CPR to the person. So one main indication is when there is a sudden respiratory failure, and the word we use to define it is asphyxia. It can be due to drowning, any gas poisonings, anesthetics or a narcotic overdose, electrocution, or in any kind of accidents. One of the major indications. The next reason can be, a progressive respiratory failure. It could be due to a paralysis of the respiratory muscles. This condition you see in diphtheria and poliomyelitis. Even, there can be a progressive respiratory failure even in a lung infection. So these two are basically the indications of artificial respiration. Now let's see the different methods of artificial respiration. So basically, if you look at the classification, there are two types of artificial respiration in practice. It's either the instrumental methods or the manual method. So let's see what the manual or the non-mechanical methods are, which is basically the way of artificial respiration given in an emergency, and that will be normally for a short period. And the second classification you all have is the mechanical method of respiration, which is normally employed for a longer period of time. So now you need to know the different the methods, or the ways employed in the manual or the non-mechanical emergency short period artificial respiration. I would be explaining even the detailed steps of all the procedure. The first you can see is mouth to mouth breathing, which is where air is expired, or expired air resuscitation. And mouth to mouth breathing is normally you can see being referred as the kiss of life. I think when I explain the procedure, you will exactly get a picture. Now the second process or the method is the Schaeffer's prone pressure method. And the third one, you have the Holger-Nielsen method, which is also commonly called as the back pressure arm lift method. So these are the three: the mouth to mouth breathing, Schaeffer's prone pressure method, and also the Holger-Nielsen method, which is the back pressure arm lift method. All the methods you will be studying by steps in detail. Now let's go to the mechanical artificial respiration, which is normally given for a longer period of time. For that you use either a negative pressure ventilators or the intermittent positive pressure ventilators. Now in the negative pressure ventilators we have the Drinker's method, the tank respirators, the iron lung chamber method. So I think you need to, very seriously, thoroughly remember these, classifications. What are the methods employed under the manual or the non-mechanical method, and what are the processes or the procedures, or what are the divisions which comes under the mechanical method of respiration. So you have the negative pressure ventilators, which can be done with a drinker's method, the tank respirators, or the iron lung chamber method. The second way of the mechanical respiration, you have the intermittent positive pressure ventilators, where an anesthetic machine is used. Now let's go one by one. First, you can see the mouth to mouth breathing. Now the mouth to mouth breathing, basically it's of two types. You have the direct method and the indirect method. Now the direct method is associated with when there is a direct contact of the victim's mouth with the operator's mouth, and the indirect method is associated where a small tube around 4 to 6 inch tube is there in between the two subject. Now in this you can see that the subject is placed in the supine position. His mouth, nose are cleaned, and even the dentures. There is no vomitous food, etc. In the mouth needs to be removed, and then the victim's head is extended backward. Now what the operator does is, the operator kneels on one side of the subject, holds the lower jaw with the left hand. You can see it in the picture. The operator is holding the jaw of the subject with his left hand, and he opens the mouth, the operator, and with the right hand he closes the nose of the victim. Now the operator places his mouth over that of the victim in such a way as to enclose the victim's mouth between his lips and exhales smoothly into the subject's airway. And the amount of air which the operator exhales into the subject's airway is something like a volume which is about twice the normal tidal volume. Now when the operator does this maneuver, it inflates, there are the pictures there. When this maneuver is done, it will inflate the subject's lung. Now the operator then removes his mouth to allow for passive expiration. Now this procedure is repeated rapidly 3 times to saturate the victim's blood with oxygen. Then continue the procedure regularly at the rate of 12 times a minute. A handkerchief can be placed between the mouth to avoid a direct contact. So I think that should be clear with mouth to mouth breathing. Now you should know what are the advantages and the disadvantages, and this is also told basically in apneic individuals where there is no heartbeat, mouth to mouth breathing is alternated with a cardiac massage or a CPR. Before I go to CPR, I would like to tell a little more on mouth to mouth breathing. You all should know the advantages and the disadvantages of mouth to mouth breathing. So advantages of mouth to mouth breathing, whether it is direct or indirect, is it is a way of artificial respiration which can be applied immediately. So that's the first advantage. Now the second is a large tidal volume of about 1000 ml can be obtained by this method can be obtained or can be delivered to the victim. Third is the carbon dioxide present in the expired air stimulates the subject respiratory center. That's a very important thing you all are going to write when this question comes. So the operator is basically exhaling air into the victim's mouth, which has got a high concentration of carbon dioxide, isn't it? It says expire. Now what happens is, this high carbon dioxide always is capable of stimulating the subject's respiratory center. Now the fourth advantage is, this technique is very simple and does not require instrumentation. So anywhere, everywhere in crisis, this mouth to mouth breathing, direct or indirect, can be employed as a life-saving method. Now, the disadvantages of mouth-to-mouth breathing is infection may spread in either direction, that is either from the subject to the volunteer or vice versa. Now, the second main disadvantage is the person may go into exhaustion. Now, this whatever I was talking to you was about when you do it in an adult, but when it's about children and infant, mouth-to-mouth breathing can be used in children and infants also. But two things need to be taken care of. The operator should cover subjects both mouth and nose, and air should be breathed out more gently into a child. These two care should be taken when the mouth-to-mouth breathing is done on children and infants. Now let's go to the next method. So here was where I stopped, and basically in apneic individuals where there is no heartbeat, once mouth-to-mouth respiration breathing is done, it should be alternated with CPR, which is called as the cardiac massage, or the cardiopulmonary resuscitation. So I've just got only a picture here. I'll just tell you what exactly it is. Now CPR is required in some patients when heart and the respiration both stop. So CPR may be required in patients with at least 2-3 conditions you can name. One is where there is ventricular fibrillation following a heart block. Second is after an electrocution shock, and third is after drowning. Now, basically the emergency plan of CPR or cardiopulmonary resuscitation is referred to as ABC of CPR. That's how you call it, which is basically used to revive patients. Now, what do you mean by ABC? A stands for airway care, B stands for breathing, and C is for cardiac massage. Now, what do you mean by airway care? Now, airway care is basically required in unconscious patients. So, immediately, the patient who is unconscious, his head need to be tilted with the hand under the neck to maintain an open airway. That has to be first done, the airway care. The unconscious subject's head should be, so you have to tilt the head back with the hand under the neck. So what happens then is you leave the airway of the unconscious subject open. Next is B, which is breathing. So breathing by artificial method is required if the patient is not breathing. Now mouth-to-mouth respiration should be immediately started, and please don't forget to feel the carotid pulse. If present, then continue the artificial respiration. Now the third, you have the cardiac massage, what you can exactly see in the picture here. Now the cardiac massage is required when the carotid pulse cannot be felt. So usually an external cardiac massage is carried out effectively without opening the chest. Now I'll exactly tell you how the procedure of CPR or how exactly the cardiac massage is done. So what happens here is the operator, whoever is doing the procedure, places the heel of one hand on the lower sternum above the xiphoid process and the heel of the other hand on the top of the first hand. I just repeat it. The operator places the heel of one hand on the lower sternum of the victim above the xiphoid process, and the heel of the other hand of the operator on top of the first one. You can see it exactly like that in the picture. Please remember this point. The heel of the operator's hand is placed over the lower part of the sternum, just above the xiphoid process. Don't miss on that. Now once the hands is placed like this, what happens is a pressure is applied straight down, depressing the sternum 4 to 5 centimeters towards the spine. Hope you get me. So once the hand of the operator is placed, heel of one hand on the lower sternum above the xiphoid process and heel of the other hand on top of the first, slight pressure is applied on the sternum. And the slight pressure, how would you know exactly how much pressure? So how you judge it is the sternum is lowered for almost 4 to 5 centimeters towards the spine. Now this procedure is repeated 80 to 90 times per minute. Now manually, what you're trying to do is you're manually squeezing the ventricles, which is very effective if the chest is already open. I think you can just leave that. So basically what you should remember is you give the pressure in such a way that the sternum is depressed or compressed 4 to 5 centimeters towards the spine, and it can be repeated 80 to 90 times per minute. Okay, so that's about CPR. Now you need to know about the Schaeffer's technique. Schaeffer's technique is a method of artificial respiration, the mechanical way, and it's normally employed in drowning. So you can see that in the picture. I'll show you the picture. See, can you see the picture there? The way the patient is made to lie down, the head tilted to one side, and where exactly the operator is giving the pressure. Let's go step by step. Now you can see that the victim lies in a prone position and his face is towards one side, isn't it? The victim is lying in the prone position with the head tilted to one side, and you can see that the operator is pressing on the loin, and he is doing that so that the intra-abdominal pressure will increase. Now when he gives pressure on the loin, trying to increase the intra-abdominal pressure, this actually pushes the diaphragm and causes expiration of the victim. Now the operator withdraws the pressure. What happens is the intra-abdominal pressure would fall. Now the diaphragm moves down, indrawing of air into the lungs. So now this technique is repeated for around 12 times per minute. So every time the operator gives pressure on the loin, it will increase the intra-abdominal pressure, it will push the diaphragm up, and it will cause expiration. Moment he releases the pressure, intra-abdominal pressure would fall, the diaphragm moves down, which will pull in air from outside into the lungs. So that way what is happening is you are trying to stimulate the respiration, or you are trying to make air enter into the lungs in an artificial way, and the Schaeffer's technique can be repeated 12 to 12 times per minute. This is exactly how the Schaeffer's technique is done. Now you have two more. This is a very beautifully given tabular column. You have the chest pressure arm lift method, which is also called as the Sylvester method, and then you have the back pressure arm lift, which is the Holger-Nielsen method. I'll just make it slightly bigger. So just look at the picture. Remove any foreign matter from the victim's mouth. That's the first thing you all need to do for both, whether it's a Sylvester method or the Holger-Nielsen method. Now, so I think we'll go one by one. The Sylvester method or the chest pressure arm lift method, first thing to be done is any foreign matter in the mouth, please remove it. Now make the victim lay flat. His face is up, and prop the shoulders to raise them and allow the head to drop back. Can you see? Now kneel at victim's head. I'm talking about what the operator is going to do now. Grasp the victim's arm at his wrist, cross them and press firmly over his lower chest, forcing air over the lungs. Can you see it? You can see it on the first picture. Immediately after that, release the pressure, push the victim's arms outward and upward and backward as far as possible over the head, forcing air into the lungs. See, by the first step, you are trying to make the victim expire, isn't it? Now, by the second step, you are trying to make the person inspire. So, now you can repeat the cycle 12 times per minute. Check mouth frequently if there shouldn't be any obstruction. Now keep the victim's head extended. So that position is very important, keeping the head extended so that the airway of the victim is always open. So that's about the Sylvester method, chest arm pressure method. Now you have the back arm pressure lift, which is called as a Holger-Nielsen method. See there, you are making the subject lie in a prone position. So again, as earlier, please make sure that there is no foreign material in the mouth. Please remove it. Now place the victim face down, bent, and place his head tilted towards, and see, make sure that his hands is placed, crossed, and his head is basically resting on his arm. And now you turn the victim's head slightly to one side, and it should be placed on his hands. You can see it exactly on the picture. Basically, the victim's head is actually, the chin is actually resting on the victim's hand. Now you have to extend the victim's head as far as possible with his chin, in the jutting position, so that his airway is clear. Now the operator is going to kneel near the victim's head, and the operator needs to place the hands on the flat part of the victim's back, and with your palm you have to uh, imagine a line. Yeah, there is a picture there. Just imagine a line is there on the victim's back, and you have to move, the operator should move the hand from the flat part of the chest to the armpit of the subject. Now once that is done, rock forward on your arms until they are vertical, allowing your upper body weight to exert steady pressure upon your hands. So basically here in the Holger-Nielsen method, the operator gives pressure in the particular directive way, which is causing air to enter the lungs of the victim. So that's about the two methods, the Sylvester method, which is the chest pressure arm lift method, and you have the Holger-Nielsen method, which is the back pressure arm lift method. Now just very brief about the mechanical respirators. So till now what we have discussed about was CPR, cardiopulmonary resuscitation. You had the different manual methods of artificial respiration. Now a little brief about the mechanical respirators. Mechanical respirators are normally used when artificially respiratory, there should be a respiratory support for the victim or the patient for a long term. So you use mechanical respirators in chronic weakness of the respiratory muscles, or it can be in acute respiratory failure or in compromised alveolar capillary changes. So whenever there is a chronic weakness of the respiratory muscle, the mechanical respirators involved are airtight devices that cover the chest, which is the negative pressure applied at intervals. Alternate inflation and deflation of the lungs is done. I think that one line speaks about what exactly is done in mechanical respirators when there is a chronic weakness of the respiratory muscle. Now when there is an acute respiratory failure or in any kind of alveolar, a very less alveolar capillary exchange, there is a lot of pressure settings or changes which are made. So it can be an intermittent positive pressure ventilation, where there is positive end expiratory pressure, which is called as the PEEP. Now air oxygen mix or carbon dioxide or oxygen mixture is given by a cuff tube directly into the trachea. Now constant preset volume ventilators are there, constant preset pressure respirators are also used. So I think that's about the mechanical ventilators. So I think that's it. That's it about it. So basically the mechanical respirators, you classify it as the positive pressure method and the negative pressure method. And in positive pressure methods is which is normally used in the operation theatres. So what happens there is the lung is inflated by pumping air, or that air mixture what I am talking about there, air oxygen mixture, carbon dioxide oxygen mixture, so that is basically used in oxygen OTs. Either continuously or intermittently it is given. The disadvantages of this method is that it actually impairs the venous return. So you would have heard about automatic ventilators. In hospitals this is used for giving artificial ventilation. This is basically an automatic instrument in which the rate, depth of ventilation and composition of the air inhaled can be varied. So these are all the positive pressure methods, what I told you just now, what is used in OT, where there is a mixture of, air is given continuously or intermittently, and these automatic ventilators are all positive pressure methods of artificial ventilation. Now next you have under this mechanical, see the same thing, I am just giving you another way to look at it. Now mechanical respirators, the second way is in which they use the negative pressure methods, and under that comes the Drinker's method, the Bragg-Paul method. So now how you achieve this is by alternating, this method of negative pressure, it alternates compressing and relaxing of the chest wall. So drinker's method is something like the iron lung chamber. There's something called as an iron lung chamber. The apparatus basically consists of an airtight chamber, and the pressure inside the chamber will be alternatively reduced and increased. So now the patient is placed inside the chamber with his neck and head outside. Whole from from the lower part of the neck to the whole body of the patient is inside this iron lung chamber, and in the apparatus you can always increase and alternate increasing and decreasing the pressure. Now when the pressure inside is increased, expiration takes place because of compression, and now when the pressure is reduced below atmospheric pressure, inspiration will take place. Now the advantages is it can be used in chronic patients, but the disadvantages is it cannot be given to a patient immediately, as it will be available only at very established hospitals. Now the second negative pressure method, if you see, is the Brock-Paul method, and this Brock-Paul method usually consists of a hollow elastic rubber bag which is wrapped around the chest of the patient. Now when the bag is inflated by a pump, the chest is compressed and the air is expelled out. Now when the pressure is released, the chest passively enlarges and the air is drawn in. Now the advantage is the same, it can be used in chronic patients. So I think that's about the artificial or the mechanical respirators, where it was divided into the positive pressure method and the negative pressure method. Positive pressure method, you had what is being used in the operation theatres, then you have the automatic ventilators, and the negative pressure method you had the drinkers methods and the Brock-Paul method. So I think we are done with this now, the artificial respiration, mechanical and the non-mechanical manual ones, with where I have even talked about CPR or cardiopulmonary resuscitation. So I think this portion should be really thorough for you all, because it can be asked for practicals and also for theory. Theory one question is sure, because the question has got clinical importance. So I think that's it in today's class. Thank you. Study well. Okay guys, bye.